And now, it's time for the Cannabis Reporter Radio Show with Snowden Bishop. Listen in as Snowden interviews cannabis industry pioneers, marijuana experts, policymakers, medical practitioners, patients, and other amazing individuals with compelling stories to share. It all happens right now. Here's the Cannabis Reporter, Snowden Bishop.
Hi, and welcome back to the Cannabis Reporter Radio Show. I'm Snowden Bishop. I'm so happy you could join us. Have you ever wondered why pharmaceutical companies bother to spend billions of dollars each year advertising drugs that can only be prescribed by a doctor? I've always found that ironic, considering that nearly half of a 2-minute commercial is spent listing debilitating side effects that often sound far worse than the conditions the drugs are meant to treat. And some, like benzodiazepines and selective serotonin uptake inhibitors, or otherwise known as SSRIs, used to treat symptoms of anxiety, depression, and psychosis, can actually lead to addiction, suicidal thoughts, and overdose. For veterans coping with the debilitating symptoms of PTSD and chronic pain of sustained wounds of war, drugs most commonly prescribed by the VA doctors can be debilitating. SSRIs are the only class of drugs actually approved by the FDA for treating PTSD, but since they have less than 30% efficacy rate and don't alleviate other symptoms that often afflict veterans, they're often prescribed along with benzos for insomnia and anxiety, and opiates frequently prescribed for the chronic pain. Combining 3 highly addictive controlled substances can be a recipe for disaster, considering that each enslaves patients with a physical dependence that can make underlying symptoms worse when the patient stops taking them, or lead to overdose when increased tolerances require higher doses to achieve the same level of effect. By contrast, cannabis has proven to be far safer for veterans, and in fact, if you ask any veteran who's been using cannabis, chances are they'll tell you that they've eliminated most of the other prescription drugs that they've been taking. A 2012 double-blind randomized clinical trial comparing the efficacy of CBD versus a potent antipsychotic for treating the psychosis associated with schizophrenia found that both led to significant clinical improvement among participants, but CBD displayed a markedly superior side effect profile and was far more effective in increasing levels of an endocannabinoid known as serum anandamide, which is one of the body's primary neurotransmitters. While the study was specifically intended to answer questions about schizophrenia, the outcome is relevant to patients suffering with PTSD. And here's why. Cannabinoids like CBD and THC stimulate the body's natural production of anandamide, which promotes a sense of well-being and mediates memory consolidation and retrieval. Since anandamide deficiency is common among veterans suffering with PTSD, well, at least that according to a study conducted by researchers at NYU Langone Medical Center, that would explain why so many have found that cannabis helps to alleviate the symptoms of traumatic memories, the nightmare, anxiety, and other symptoms of PTSD without the deadly side effects of the prescription drugs dispensed at the VA. We have yet to see the results of the first FDA-approved clinical trial involving veterans to test the efficacy of cannabis for treating PTSD, but like I said, there's plenty of anecdotal evidence that cannabis is far more effective than any of the other drugs that are most commonly prescribed at the VA. So if cannabis helps veterans cope with the symptoms of PTSD, there really is no excuse to deny them safe legal access to it. As of today, there are more than 47 bills that have been introduced in Congress to address the issue, and of those, only one, the Safe Banking Act, has been signed into law. Only one other bill has been passed by a bipartisan majority in the House, and the rest have yet to emerge from committees for a floor vote. In the meanwhile, lives are being lost or ruined by arcane policy that promotes the use of deadly addictive drugs that are not only rarely effective, but often cause more harm than good, impacting not just the veterans, but their families as well, with more than 20 veteran suicides every day and even more suffering with addiction. Considering that there's overwhelming public support for legalization, Congress really shouldn't be delaying cannabis policy reform. In fact, an overwhelming majority of veterans want safe, unrestricted access without losing their benefits or risking prosecution. Fortunately, there's a growing coalition of veterans who are likely to turn the tide on Capitol Hill. When organizations like Veterans Cannabis Project get involved to make the case, it carries more weight in Congress. And that's the topic of today's show, and I'm really excited to introduce our guest because he happens to know a lot about this. Lieutenant Colonel Doug Distasto is a veteran of both the Afghanistan and Iraqi wars who served for more than 21 years in the U.S. Air Force in the field and at the Pentagon. As a combat pilot and intelligence officer, he's commanded personnel globally, including in counterterrorism hotspots from Europe to the Pacific. He's also served as a primary legislative affairs lead for 2 USSOCOM commanders. His life took an unfortunate turn when he sustained multiple injuries and a brain trauma in a plane accident. And his ability to cope with the demands of military duty was a matter of managing his chronic pain and PTSD. By the time he retired, addiction had consumed his life. And it wasn't until he learned about the medical benefits of cannabis that his life turned around. Since then, he has dedicated his post-military life to ensuring a better future for veterans facing similar challenges. As the executive director of Veterans Cannabis Project, he leads efforts to increase awareness about the benefits of medical cannabis as a safer alternative for veterans and coordinates with state and federal lawmakers to influence policy that will help veterans gain legal, unrestricted access to cannabis. Doug also serves as the Vice President of Legislative Affairs for Security, Defense, and Space at Navigators Global, which is a government relations, strategic communications, and issues management firm located in Washington, D.C. That position makes him uniquely positioned to advocate on behalf of veterans. Doug, thank you so much for joining me today. I'm really excited about this conversation.
Thank you. I'm really excited to be here too and talk about this important issue.
Oh, you're welcome. I'm so glad you're here. Before we get started, I just want to say thank you so much for your service. I mean, you've done some extraordinary things. And I'd actually like to hear in your words a little bit about your journey and how you began advocating for cannabis.
Okay. So a little about me. I served 21 years in the U.S. Air Force, 25 if you count Air Force Academy time, which I like to do because it was as intense as the rest of it. And at the end of that, I was injured while doing my daily job and flying airplanes. And so, at that point, I was a lieutenant colonel. I was promoted to colonel. Well, after the injury, I couldn't fly airplanes anymore, and I couldn't do a lot of the things that I wanted to do. And so it hit a big speed bump in my life and sort of changed, obviously, the direction and where my mind was at the time. And so where that led me was after this injury, I had traumatic brain injury and just a bunch of bodily injuries that were really slowing me down. And so in order to keep functioning, to keep whatever pain at bay, to keep the anxiety down was various pills, various treatment options. I was doing physical therapy, all of the normal things you would use, pills in particular, and I'm talking antidepressants, opiates, a lot of the things that you'll hear about when veterans talk about sort of these signature wounds. I was struggling to get myself back together and be the compassionate, together officer, first of all, because I was still in the military, that I wanted to be prior to this accident. And so I just couldn't find any way out of, this cycle of pills. As long as I was in the military, I couldn't really find a path. And I was living up here in DC at the time trying to rehabilitate, and a friend of mine mentioned cannabis to me. So living this close to DC, I had some other incidents happen. My family and I got to the point where we decided I had to change something. And that's something I'd been living sort of within the military with these injuries and that cocktail of sort of treatments for long enough to know I wasn't going to get better anytime soon. And so I got out, used my proximity to the DC market to try cannabis and wean myself off of all these other things through some really hard work and great support. I made it out of that and, found myself on the outside of the military, now feeling better and functional again. And it really got me thinking about it. Man, if that happened to me, if I was able to pull myself out of that nosedive, really on my own, what could happen if we did this at scale and really helped people work their way back towards health. So that's kind of the full circle of military career into how I got involved in this. And I was contacted by the founder of this organization who asked me to push up sort of the intensity of it and see if we could get some movement on veterans' health and cannabis. So that's what we've been doing since about January.
Well, congratulations on that. As I've mentioned in my opening, a lot of the medicines that are used to treat veteran injuries specifically exacerbate the problem in a big way. And I really think it takes a lot of courage to acknowledge that it's the medical treatment that is causing a lot of the issues. Is that something that you really felt was happening to you, that the medicines you were taking to treat your injuries and to treat the anxiety were causing more or worse problems for you?
I think that's a fantastic question. And I go over this a lot in my mind as we try and diagnose, what went on with me and how to help other people. And what I'd say is that nobody really knows the effect of interactions when you start getting to 5, 10, 15 different pills, right? I mean, we all respond differently even to the same pill. And so when you start combinations of them, I agree with you. I think it affects all of us in different ways, certainly negatively. We are very careful at the VCP not to try to put cannabis up as something that's a panacea. I mean, I think every medicine, every treatment option has its place that you need to use appropriately. And so to your point, I know for certain, and I tell this story when I go talk to vets around the country, is I fell asleep opening Christmas gifts on Christmas morning with my family because of the pills. I don't know what else it could have been, right? That's not something that I would have ever done or I would have ever seen myself doing. And so, when your wife sort of wakes you from a slumber at that point in your life, you can't help but try to find something to change. And that's something that I decided to change, was this regimen that I'd been under, in varying forms and degrees and different combinations of pills. And it just wasn't working for me. And so to come again back full circle, it wouldn't surprise me if we find out that these big combinations of different classes of drugs really do things that we hadn't anticipated. And we need to prevent that as much as possible, certainly for veterans who are returning and transitioning to civilian life and trying to really, keep themselves together. That's a really tough combination of things for them to deal with.
Right. And if this is too personal, let me know. But were you also suffering with some post-traumatic stress?
Yes, I was a special operations pilot for most of my career. So I'm fortunate or unfortunate enough to take part in, most of the big events that have happened over the last couple of decades. And, what I would say is I really tried hard to compartmentalize all of that, right? And it was a job that you did, and it was something that you believed in, and all of that. And I still firmly believe it. But for me, when you ask about PTSD, I had thoughts of the things I'd done that I wasn't able to keep out of my head when I was on some other regimens. I mean, quite frankly, it's still difficult now. I mean, when you spend age 17 to age 42 in the military and engaged in doing all these things around the globe, it's an adjustment anyway. And so to your point, I think I've been dealing with PTSD, and whether it just reached its height there or whether I think, as I'm trying to highlight, I think a lot of the treatment protocols surrounding it aren't helping veterans, then yeah, I think it's important that we acknowledge that PTSD, we haven't had a novel treatment for PTSD in quite some time. It would be great to see, and this is what we really push for at the VCP, is why is cannabis helping all these people with PTSD, myself included? And I think that's what we're curious about as an organization.
No doubt you've probably heard of Dr. Seuss Lee.
I have. In fact, we did, as part of the Veterans Cannabis Project, and Curaleaf has been gracious in partnership with us to to spread the message of veterans health and access to this, we did a launch out in Arizona, and Dr. Sisley was there with me.